Right now, somewhere in the world, a perfectly healthy person over the age of 60 is taking a pill they believe is helping them, and that pill is slowly, quietly destroying their kidneys. And the scariest part, their doctor may have even recommended it. If you are over 60, or if you love someone who is, the next 20 minutes could genuinely change or even save a life. Stay with me, because what I'm about to share with you is not something most people ever hear in a routine doctor's visit. And by the time this video is over, you will know exactly which common medications are putting your kidneys at serious risk, why the risk skyrockets after the age of 60, and most importantly, 3 simple, practical solutions you can act on starting today. Let's start with a number that should stop you cold. According to the National Kidney Foundation, approximately 37 million Americans are currently living with chronic kidney disease, and a staggering 90% of them have absolutely no idea. No pain, no obvious symptoms, just a slow, invisible decline in kidney function happening quietly in the background while life goes on as normal. Now here is what makes this even more alarming. As we age, our kidneys naturally lose some of their filtering capacity. By the time most people reach their 60s, kidney function has already declined by as much as 30 to 40% compared to what it was in their 30s. That means the kidneys you have right now are working significantly harder to do the same job, and they are far more vulnerable to damage from medications than they were 2 or 3 decades ago. The kidneys are 2 of the most extraordinary organs in the human body. Every single day, your kidneys filter approximately 200 litres of blood, that is roughly 50 gallons, removing waste, balancing fluids, regulating blood pressure, and producing hormones that keep your bones strong and your red blood cells healthy. But here is the thing about kidneys that most people don't fully appreciate. They are not just passive filters. They are highly active, metabolically demanding organs with an enormous blood supply. Roughly 20 to 25% of every heartbeat flows directly into the kidneys. That means any substance circulating in your blood, including every medication you swallow, arrives at the kidneys in high concentration, and the kidneys must process it, break it down, and excrete it. When a drug is toxic to kidney cells, even in small amounts, the kidneys bear the full brunt of that toxicity, day after day, dose after dose. Now add aging into that equation. After 60, the kidney's filtering units called nephrons begin to decrease in number and efficiency. The blood vessels supplying the kidneys become stiffer and less responsive. The kidneys become less able to adapt quickly to changes in fluid volume, blood pressure, or drug concentration. This means that a dose of medication that a 35-year-old's kidneys could handle without a second thought can, in a person over 60, accumulate to dangerous levels, reduce blood flow to the kidney, or trigger inflammation in the delicate kidney tissue. This is not a fringe medical opinion. This is mainstream nephrology, the study of kidney health, and it is why every board-certified nephrologist I know will tell you that medication management is one of the single most important conversations older adults need to be having with their doctors. So let's get into the 5 specific categories of pills, medications that millions of people over 60 are taking right now that can be seriously harmful to kidney health. I want you to understand not just what these medications are, but why they cause damage, what the warning signs look like, and what you and your doctor can do about it. The first category, and arguably the most widespread source of kidney damage in older adults, is NSAIDs, non-steroidal anti-inflammatory drugs. You know these well: ibuprofen, sold under brand names like Advil and Motrin; naproxen, sold as Aleve; diclofenac, indomethacin, ketorolac. These are the go-to medications for joint pain, back pain, arthritis, headaches, and inflammation. And for many people over 60, they are taken daily, sometimes for years. Here is the problem. The kidneys rely on a specific group of chemical messengers called prostaglandins to maintain healthy blood flow to their filtering units. NSAIDs work by blocking the production of prostaglandins throughout the body. That's how they reduce inflammation and pain. But in doing so, they also eliminate the kidney's primary mechanism for protecting itself when blood pressure drops or blood flow decreases. In a young, healthy person with strong cardiovascular function and robust kidneys, this is generally tolerable in the short term. In a person over 60, especially one who has even mild underlying kidney disease, high blood pressure, heart failure, or takes diuretics, which is a very common combination in older adults, blocking those prostaglandins can cause the blood flow to the kidney to drop sharply, leading to what doctors call acute kidney injury, or AKI. Even a single high dose of ibuprofen taken during a period of dehydration or illness can trigger an episode of AKI in a vulnerable older adult. And repeated episodes of acute kidney injury do not fully heal, they leave behind scar tissue, permanently reducing kidney function. Over months and years, this adds up to significant, irreversible kidney damage. Studies have shown that regular NSAID use in adults over 60 is associated with a 50 to 100% increased risk of chronic kidney disease progression. That is not a small number. And yet, these drugs are sold over the counter, without prescription, and often without any warning about kidney risk on the front of the package. Now, I want you to hold that information about NSAIDs in mind as we move to the second category of kidney-damaging pills, because the connection between these two is something most people never realize. The second category is certain antibiotics, specifically a class called aminoglycosides, which includes drugs like gentamicin, tobramycin and amikacin, as well as other antibiotics like vancomycin, and an older class of antibiotics called sulfonamides. Now, most people over 60 won't be taking these routinely at home. Aminoglycosides are typically given intravenously in hospital settings, but here is why this matters to you. If you are admitted to a hospital for any reason, a urinary tract infection, pneumonia, a surgical procedure, and you are over 60 with some underlying kidney vulnerability, these drugs can be prescribed. Aminoglycosides are directly toxic to the kidney's tubular cells, the cells responsible for reabsorbing water, electrolytes and nutrients back into the bloodstream. The older you are, the smaller your margin of safety. The drug can accumulate because your kidneys cannot clear it as efficiently, and toxic levels build up in kidney tissue before anyone realizes what's happening. The damage can be swift, severe, and sometimes permanent. This is why, if you or a loved one is ever hospitalized and a doctor recommends antibiotic therapy, it is completely appropriate, even essential, to ask whether the medication being prescribed is safe for your kidneys and whether your kidney function will be monitored during treatment. Don't let embarrassment or deference stop you from asking that question. A good doctor will respect you for it. The third pill category that every person over 60 should know about is proton pump inhibitors, or PPIs. These are among the most commonly prescribed medications in the entire world and among the most widely used over-the-counter drugs as well. Omeprazole, esomeprazole, lansoprazole, pantoprazole, brand names like Prilosec, Nexium, Prevacid, Protonix. If you have acid reflux, heartburn, or a history of ulcers, there is a very good chance you are taking one of these right now, possibly every single day. And while PPIs are genuinely effective for managing stomach acid and preventing ulcer complications, research over the past decade has revealed a deeply concerning connection between long-term PPI use and kidney disease. Multiple large studies, including a major analysis published in JAMA Internal Medicine, have found that people who use PPIs regularly are significantly more likely to develop chronic kidney disease compared to people who don't. One study found that daily PPI users had a 20 to 50% higher risk of CKD progression and a 20 to 30% higher risk of kidney failure. The exact mechanism is still being studied, but researchers believe that PPIs may cause a condition called interstitial nephritis, an immune-mediated inflammation of the kidney tissue in some patients. The insidious part is that this inflammation is often silent. It doesn't cause pain. Patients have no idea it's happening. By the time it's detected, meaningful damage may already have occurred. The second problem is that PPIs are vastly overprescribed and overused. Studies suggest that up to 70% of people taking PPIs don't actually need them for a legitimate long-term medical reason. They were prescribed for a short-term issue, or they started taking them over the counter, and now they've been on them for years out of habit and fear of symptoms returning. If you are over 60 and you are taking a PPI daily, please talk to your doctor about whether you still truly need it, what the lowest effective dose is, and whether alternatives like H2 blockers or lifestyle modifications might be appropriate. This conversation could genuinely protect your kidneys for years to come. Moving on to the fourth category, and this one surprises most people because it involves medications that are actually designed to protect the heart and manage blood pressure. We are talking about certain diuretics, specifically when used inappropriately or without proper monitoring, and a class of drugs called ACE inhibitors and ARBs, angiotensin-converting enzyme inhibitors, and angiotensin receptor blockers. Now here is where I need to be very careful and very precise, because I am not telling you to stop taking your blood pressure medication. ACE inhibitors and ARBs, drugs like lisinopril, enalapril, ramipril, losartan, valsartan, are actually kidney protective in many patients, particularly those with diabetic kidney disease or proteinuria. They are prescribed specifically because they reduce the pressure inside the kidney's filtering units and slow the progression of kidney damage. For many people, these drugs are beneficial and should be continued. However, and this is the critical nuance, in certain situations, particularly in older adults who are also taking NSAIDs or who become dehydrated due to illness, vomiting, diarrhea, or excessive heat, the combination of an ACE inhibitor or ARB with reduced fluid volume can cause a dangerous rapid drop in kidney blood flow, leading to acute kidney injury. Nephrologists sometimes call this the triple whammy, when a patient is on an ACE inhibitor or ARB plus a diuretic plus an NSAID all at once. This combination is one of the most well-documented causes of drug-induced acute kidney injury in older adults. It does not mean you should stop your blood pressure medication. It means you need to be aware of this interaction, discuss it with your doctor, and know that during any illness that causes significant fluid loss, your medication regimen may need temporary adjustment under medical supervision. And that brings us to the fifth category, one that is increasingly relevant for older adults managing multiple chronic conditions. We are talking about certain diabetes medications, specifically an older class called metformin, and a newer and widely celebrated class called SGLT2 inhibitors, drugs like canagliflozin, dapagliflozin and empagliflozin, sold under brand names like Invokana, Farxiga and Jardiance. Let me be clear again, SGLT2 inhibitors are actually showing remarkable kidney protective benefits in clinical trials and are now being prescribed specifically to slow kidney disease progression in diabetic patients. Metformin is generally safe and effective for most people with type 2 diabetes, but here is the concern. Both of these medication classes can cause or worsen a dangerous condition called volume depletion, essentially, dehydration at the cellular level, and in a person over 60 whose kidneys are already working with reduced capacity, this depletion can trigger acute kidney injury, particularly during hot weather, illness, or when other kidney-stressing drugs are also present. Additionally, metformin must be used with extreme caution and sometimes stopped in patients whose kidney function has already declined below a certain threshold, because poor kidney clearance allows metformin to accumulate in the blood, raising the risk of a rare but life-threatening complication called lactic acidosis. This is why regular kidney function monitoring, checking your creatinine and estimated GFR at least once or twice a year, is absolutely essential for any older adult managing diabetes with medication. Now, I've just walked you through 5 major categories of medications that can damage kidney function in adults over 60. And I want to acknowledge something important right now. I know some of you are watching this and feeling anxious, maybe even panicked. Maybe you're on 2 or 3 of these medications and you're wondering whether you should just stop taking them. Please hear me clearly. Do not stop any prescribed medication without talking to your doctor first. Abruptly stopping blood pressure medication, diabetes medication, or other prescribed drugs can cause serious, potentially life-threatening complications. What I am giving you today is knowledge. The knowledge to have a better, more informed conversation with your healthcare provider, knowledge to ask the right questions, to request the right monitoring tests, and to be an active participant in protecting your own health. Which brings us perfectly to the 3 easy, practical solutions I promised you at the beginning of this video. These are not complicated, they are not expensive, they are actionable steps you can start on today. The first solution is to conduct a full medication review with your doctor and specifically request a kidney safety audit. Write down every single pill, tablet, capsule, supplement and over-the-counter medication you take, including vitamins, herbal supplements and pain relievers you use occasionally. Bring that list to your next appointment and ask your doctor, are any of these medications a concern for my kidney health given my age and current kidney function? Ask about interactions. Ask whether any of them can be reduced in dose, replaced with a safer alternative, or stopped altogether. Many older adults are prescribed drugs that were appropriate 10 or 15 years ago but have never been reassessed in the context of aging kidneys. This review could reveal opportunities to simplify your medication regimen in ways that genuinely protect your long-term kidney health. If your primary care physician seems dismissive or rushed, consider requesting a consultation with a nephrologist, especially if you have diabetes, high blood pressure, or a family history of kidney disease. The second solution is to know your numbers, specifically your eGFR and your urine albumin to creatinine ratio. eGFR stands for estimated glomerular filtration rate, and it is the gold standard measurement of how well your kidneys are filtering. A healthy eGFR is above 90. An eGFR between 60 and 90 indicates mild kidney function reduction. Below 60 signals moderate kidney disease, and below 30 is severe. If you are over 60 and you have never had your eGFR checked, or if it has been more than a year since your last check, please ask your doctor for a simple blood test. The urine albumin to creatinine ratio, or UACR, is another critical test that detects protein leaking into the urine, one of the earliest signs of kidney damage. Together, these two tests can give you an incredibly clear picture of where your kidney health stands right now, before any major damage occurs. Knowledge is protection. If you discover early that your kidney function is declining, you and your doctor can take targeted steps to slow or stop that decline before it becomes irreversible kidney failure. The third solution is hydration and lifestyle. And I know that sounds basic, but the science behind it for kidney protection after 60 is genuinely profound. Chronic mild dehydration is one of the most underappreciated threats to kidney health in older adults. As we age, our thirst mechanism becomes less sensitive. We simply don't feel thirsty as readily as we used to, even when our bodies need water. This means that by the time an older adult feels thirsty, they may already be significantly dehydrated, and a dehydrated kidney is far more vulnerable to medication toxicity, reduced blood flow, and the formation of kidney stones. Aiming for at least 6 to 8 glasses of water per day, adjusted for your individual health status and your doctor's guidance, particularly if you have heart failure or other fluid restrictions, is one of the simplest and most powerful things you can do to protect your kidneys. Beyond hydration, reducing sodium intake helps control the blood pressure that damages kidney blood vessels over time. Managing blood sugar, if you have diabetes, is paramount. High blood glucose is the #1 cause of kidney disease worldwide. Avoiding smoking, keeping a healthy weight, and engaging in regular moderate physical activity all significantly reduce kidney disease risk. These are not new recommendations, but their impact, specifically in the context of protecting medication-stressed kidneys after age 60, cannot be overstated. Let me take a moment here to address something that I hear from patients and viewers all the time. People say, "But my doctor prescribed this medication. Surely it's safe." And the truth is, your doctor prescribed it because at the time of the prescription the benefits outweighed the risks, and that may still be true. But medicine is not static, and your body at 65 is not the same body that received that prescription at 55. Doctors are extraordinarily busy. They are managing complex patients with multiple conditions across very short appointment windows. It is genuinely difficult for even the best physicians to constantly reassess every medication in the context of gradual kidney function changes. That is why your role as an informed, proactive patient matters so much. You are not challenging your doctor by asking questions about kidney safety. You are helping them help you better. The best medical relationships are collaborative ones, where you bring information and they bring expertise, and together you make the best decisions for your health. I also want to spend a moment on something that often gets overlooked in conversations about kidney-damaging medications, and that is the world of supplements and herbal products. Many older adults assume that because something is natural, it is automatically safe for the kidneys. This is unfortunately not true. Acetolic acid, found in certain herbal products and traditional medicines, is one of the most potent kidney toxins ever identified and has been directly linked to kidney cancer. High-dose vitamin C supplementation has been associated with oxalate kidney stone formation. Chromium picolinate, licorice root, certain Chinese herbal teas, starfruit, and products containing creatine in large doses have all been implicated in cases of kidney damage or accelerated kidney disease. When you conduct that medication review I described earlier, make sure every supplement and herbal product is included. If your nephrologist or primary care doctor is not asking about supplements, bring them up yourself. What you are not disclosing could be contributing to a problem you don't even know you have. Finally, I want to circle back to where we started, that statistic about 37 million Americans with kidney disease who don't know they have it. Chronic kidney disease is called a silent killer for good reason. The kidneys are remarkably resilient and adaptable. They can lose 50, even 60% of their function before a person feels anything significantly wrong. By the time symptoms like swelling in the legs, fatigue, changes in urination or high blood pressure become obvious and persistent, the disease is often already at an advanced stage. This is why the entire conversation we have had today is not about fear, it's about awareness. It's about using what you now know to ask better questions, make smarter choices, and give your kidneys the respect and protection they deserve. Because here is the beautiful truth, the kidneys are not fragile. They are powerful, extraordinary organs. And when you remove unnecessary threats, when you manage medications wisely, stay hydrated, know your numbers, and work proactively with your healthcare team, your kidneys can continue to serve you well for decades more. To bring everything together, the 5 pill categories most dangerous to aging kidneys are NSAIDs like ibuprofen and naproxen, certain nephrotoxic antibiotics, long-term proton pump inhibitors, and dangerous combinations involving diuretics, ACE inhibitors or ARBs, particularly alongside NSAIDs, and certain diabetes medications in the setting of poor kidney function or dehydration. The 3 solutions are a full medication and kidney safety review with your doctor, knowing your eGFR and UACR numbers through regular testing, and committing to proper hydration and kidney protective lifestyle habits. If this information helped you today, if it opened your eyes to something you didn't know before, please take 10 seconds right now to like this video, subscribe to the channel so you never miss a video like this one, and drop a comment below telling me which of these 5 medications surprised you the most. I read every comment and your responses guide the topics I cover next. Your kidney health is worth protecting, and you now have the knowledge to start doing exactly that.